Hello, mommies. You have just gone through the most transformative experience of your life, childbirth. But there is something that often gets overlooked in the excitement of the newborn phase, and that is your health. Postpartum checkups are just as crucial as prenatal visits, yet many new moms skip them. So don't make that mistake. Let's dive into why these checkups are so important and how they can make all the difference in your recovery. First off, why are postpartum checkups so important? After childbirth, your body needs to heal. You might be feeling like yourself, but things are still changing. Your body has gone through a major shift physically, emotionally, and hormonally. A postpartum checkup ensures that you are healing well both inside and out. So, what happens during these checkups? You might be surprised by how much is covered. At the checkup, your doctor will assess your physical recovery. They will check your uterus, your wound, if you had a C section, and your overall well being. They will also take a close look at your mental health. Postpartum depression is common, and early intervention can make all the difference. What are the main causes of complications after birth that might require a visit to the doctor? First, let's talk about bleeding. It's normal to have vaginal bleeding after childbirth, but if the bleeding doesn't stop or gets worse, it's a problem. This could be a sign of an infection or something more serious like retained placenta. Pain is another red flag. While some soreness is to be expected, intense or prolonged pain is not. It could be a sign of an infection at the site of C-section area or vaginal tears. Then there is urinary or bowel problems. If you are having difficulty urinating or experience pain during urination, it's a sign something might be wrong. Similarly, constipation or painful bowel movements should not be ignored. Breastfeeding problems can also signal the need for medical attention. If you are struggling with engorged breast, pain, or breast infection, it's time to call the doctor. And lastly, don't ignore your mental health. Feeling overwhelmed, anxious, or depressed is common, but it should never be ignored. A doctor can offer support and resources to help you feel like yourself again. And now, let's dive into the remedies and self care tips that will help you during your recovery period. First and foremost, rest. Sleep whenever you can. Your body is still recovering and rest is critical for healing. Make sure you are eating nutritious foods. Focus on iron rich foods to help replenish your blood supply and keep your energy up. Protein and fiber will help your body recover, while vitamin rich food will boost your immune system. And hydration is also key. Drinking water is essential for both recovery and breastfeeding. So keep that water bottle within arm's reach. And don't forget about your pelvic floor. Gentle pelvic floor exercises can help with recovery, especially if you had a vaginal delivery. But always check with your doctor before starting any exercise routine. If you had a C-section, avoid heavy lifting and strenuous activity until your doctor clears you. You will also want to keep the incision clean and dry. And finally, let's talk about when to visit the doctor. You should definitely schedule a postpartum checkup within 6 weeks after delivery. But even if you are feeling fine, don't skip it. This is the time to discuss anything that's bothering you physically or emotionally. If you experience any of the following, see your doctor immediately. Uncontrolled bleeding, severe abdominal pain, severe headache or blurry vision, painful urination or difficulty emptying your bladder, signs of infection, painful breast, feeling emotionally overwhelmed or detached. Postpartum checkups are not just about the baby, they are about you too. Taking care of yourself is just as important as taking care of your newborn. So don't put off your checkups. Your doctor is there to help you recover and thrive.